going to take a few minutes to talk about the three elements of risk. These are exposure, susceptibility, and severity. When we're talking about exposure, we're talking about the prevalence of the hazard. What's the baseline likelihood that it occurs in a given area, region, community? So think about the probability of a hurricane in a coastal community. We know with a fair amount of certainty what that is going to be over time. When we talk about susceptibility, we're going kind of a step further and saying what's the likelihood of harm for that particular individual or that particular community. The likelihood of that harm given exposure to the hazard, or in this case, the hurricane, might be driven by a variety of factors. It could be driven by the distance of your home or your residence from the coast. It could be driven by the quality of the infrastructure, the quality of the home that you're living in, or of the surrounding roads and other infrastructure that might help protect that home. It might also be driven by the personal resources you have available to yourself to prepare for those events or even to evacuate if that's what's needed. That third piece of severity is saying what's the severity of the harm if that hazard is experienced. So if you are exposed, if you are susceptible, what are the severity of those consequences or those harms? And so this would be knowing whether those consequences are just going to be property damage, whether they're going to be experiencing perhaps a power outage for some period of time, or even in the worst case, morbidity or mortality. What's problematic is all three of these dimensions of risk are really important to understanding what the eventual harm might be to the individual or the community, but we might have cases where one of those dimensions is high and two are low, or one is high, one is a bit unknown and variable, and the other is low. But research shows that we want at least two of those three dimensions to be high in order to motivate people to take action. So just to give a couple of examples, we have a lot of examples where everyone is exposed, so that exposure is high, but the susceptibility and the severity might be low. This is often the case for a variety of different natural hazards that communities experience. It might even be the case of infectious diseases where we know we're going to be exposed to that hazard, but our individual susceptibility might be low. And even if our susceptibility is a little bit higher, the severity of those outcomes might be low. Some minor property damage, maybe a head cold for a few days. In other cases, we might have hazards where hardly anyone is exposed, but the susceptibility is variable and the severity is high. So think about these low probability, high consequence events, terrorism, shark attacks, right? This hardly happens to anyone. And even your personal susceptibility might vary. If you don't swim in the ocean, then you are not susceptible to a shark attack. But if you are susceptible, if you're a surfer, when that event does occur, even if it's very low likelihood, the severity can be very high. It's important for people to understand all three of these dimensions and for you to know which of those dimensions is the missing piece of information that your target audience needs.